Hello everyone! Have you ever felt like you were choking and didn't know what to do? In this video, we'll show you a step-by-step procedure for dealing with a choking situation. Hands clutching the throat is a universal symptom of choking. Look for the following signs if the person does not give the signal like inability to communicate, breathing problems or noisy breathing. When trying to breathe, there are squeaky sounds, coughing which might be weak or strong, turning blue or dark on the skin, lips and nails, skin that has been flushed turns pale or bluish, or consciousness loss. The procedures for administering first aid to a choking adult and a child under the age of 1 are provided. Now, let's start doing the Heimlich maneuver or abdominal thrust in adults. If the patient is conscious, ask if he is choking. If the patient is still able to speak, convince him to cough hard. If he is unable to speak and simply nod, start the abdominal thrust. Position yourself behind the patient and do the tripod position. Place your fist 2 fingers above the navel. Do the inverted J motion until the object is dislodged or until the patient falls unconscious. When the patient passes out, lay him down on a hard and even surface like the floor. Check his mouth and see if a foreign object was discharged and remove it by finger sweep. After removal or if there's no foreign object, perform 30 chest compressions. Continue until the patient regains consciousness or until the rescue team arrives. If the patient becomes conscious, place him on a recovery position. Then, these are the procedures in doing the Heimlich maneuver or abdominal thrust in infant or babies. Place the baby face down over your forearm, supporting the head and neck with your hand. Sit to support your arm on your thigh. Give 5 back slaps down and towards the head, right between the baby's shoulder blades. If the object doesn't come out and the baby is still wiggly squirmy, turn the baby face up, supporting their head and neck. Give 5 chest thrusts just below mid-nipple line over the center of the chest. If there's no cry, no cough, and just screaming, begin the series of 5 back slaps and chest thrust again. Continue until airway is clear. The baby cry and begins to breathe or until the baby becomes fluffy and unconscious in your arms. If the baby becomes unresponsive, place the baby on his or her back on a hard surface such as the table or the ground. Yell for help. If you're alone, you'll need to give 5 cycles of CPR. First, you're gonna find your hand positioning 2 fingers just below the mid-nipple line in the center of the baby's chest. Push hard and fast. Count out loud to a count of 30. After 30 compressions, you'll need to check the infant mouth to see if the object has come forward. If nothing is there, you're going to attempt to give 2 breaths. Covers the baby's mouth and nose with your mouth. If air doesn't go in, we'll need to complete the 30 compressions and breaths again. Continue giving compressions, checking the mouth, and attempting to breathe until the object comes out. The baby wakes up, cries, or coughs, or until the emergency personnel arrives to assist you. So those are the procedures in doing the Heimlich maneuver or abdominal thrust for adults and babies. Let us keep in mind that safety is crucial for both ourselves and others. Simple first aid such as the one shown here is also vital so that we are always prepared in the event of a tragedy. We hope you learned something